Hi, I'm Kait Gotthardt, and I did my project on my own agency that I created called Face Everything and Recover. Okay, well now the buttons are working, so just try this. There we go. Okay, so the vision of Face Everything and Recover is to empower each individual to take charge of their own life in a positive manner through self-evaluation, group counseling, positive coping skills, and self-empowerment. Heroin use in St. Louis is a major problem and continues to be. St. Louis, the reason that heroin use continues to grow is because there's lack of resources, which causes the heroin users to become addicted. This agency helps users become sober, confident in themselves, and how to live a positive life in the community. I'll just do this. The needs assessment of this agency. There's a growing population of heroin users in the St. Louis area. In 2007, there were 69 overdose cases of heroin use, and by 2012, there were 244 cases. So as you can see, that was a huge increase in just 4 years. St. Louis has a diverse population with 6 different ethnicities and a population of 2.2 million people. The differences within income levels, we have the north and south side and east and west side of St. Louis, and there's different income levels and cultural differences that has resulted in an increase of drug use. The St. Louis area is struggling to provide services for heroin users because there are too few numbers of treatment programs available. In St. Louis, there only are about 3 or 4 agencies that actually deal strictly with drug use. I know that there's one for alcohol and substance abuse, but it doesn't just focus on the drug addiction. My strategic plan, the first goal would be creating an educational curriculum appropriate to be used in middle school and high schools. In St. Louis, right now, we don't have a curriculum for the heroin or street drugs in high schools or middle schools. We have the DARE program and we teach abstinence, but that's not, DARE goes over marijuana use and alcohol and smoking, not the meth, cocaine, or heroin, or crack cocaine. My objectives would be to create the curriculum, secure the commitments from the middle school and high schools so they understand the program fully. The training of health teachers, school nurses, school counselors, and etc., along with probably the PE teachers, the SPED teachers, so they also can implement the program and curriculum as well, and development sufficient funding for the agency. My action steps to implement this goal would be research age-appropriate materials for the middle school and high school, present the curriculum to middle and high school superintendents, present a document for the superintendents to sign to commit to the curriculum that I presented to them, saying that they will implement this in their schools, hold an assembly for the teachers and just for the teachers and staff and faculty. The pre and post, I would give them pre and post testing, so give them a test before and after showing the knowledge that they've gained, so I could do a research project on that. Grants, I tried some grants. Consult for a fee with the police department and DCFS, and then funders. And what I mean by consult for a fee with the police department and DCFS is I would want to give them the training also. So maybe police departments, we do have police in middle schools and high schools now. So if they know about the curriculum along with DCFS, it could better train them, or they could understand more of what the school is implementing to help their students. My second goal would be treatment. My objective is to create treatment services, and my action steps to do this would be hire 2 professional social workers. The workers would make $40,000 a year. The office space, and we would have to advertise. The office space, we would have to find a big enough office or building to support what we are trying to do as an agency And advertise would be pamphlets, brochures, through social media, and probably through email or online. My SWOT analysis. The internal strengths of Face Everything and Recover would be it is good leadership, dedicated staff, and great communication skills with the employees and with our clients. Our internal weaknesses would be we are a new agency, so we do struggle in certain areas. We are disorganized in some aspects, maybe understanding what the client's real need is at the very beginning, or we might need new paperwork, and then our small volunteer base. Since we're new to agency, we're not going to have a ton of volunteers coming in up until maybe we become more popular within the community. Our external opportunities are developing partnerships with other programs and extensive media attention to the heroin problem in St. Louis. The external threats are increased local competition. Maybe by the time our agency gets rolling, other agencies will step up their game and want to better help the community, which is great because we really need it in St. Louis. The poor economy and lack of public understanding about the community problem. We have a huge problem with heroin users right now, and there's just a lack of understanding and knowing about this problem. The budget for my agency, the executive director would make $40,000 a year, the program director would make $32,000 a year, and the office manager would make $30,000 a year. The other expenses, furnishings would be about $4,000, faculty related would be about $4,000, or $3,500. Contracted services would be about $2,000, marketing and advertising about $2,000, and then other would be about $5,000. And then my grand total would be about $120,000 to implement this agency.
Is it a 1 year or 2 year?
2 year. My conclusion: through ongoing research, programming, and treatment programs, this agency will really benefit the heroin users of St. Louis, Missouri, and others in the community. Any questions?
Sure, I have a question.
Okay.
So it's a comprehensive plan that it's got both prevention and treatment, right?
Mm-hmm.
So, given your own personal interaction with this issue and past experience, do you feel like your plan can address and make an impact on the people you have worked with or known with the substance abuse issues?
I personally do. I've worked with a lot of heroin users within this past year, and they always, and I've asked them, why do you use? Why are you doing this? And they say that they don't have, they don't have the coping skills, the positive coping skills. They turn to the negative, using drugs or drinking. Also, they didn't, it's not an excuse, but they weren't educated on it. Somebody says, hey, try this, and they try it, and then they're hooked. So it's a very, very addicting drug. You can get hooked on it with the first shot of heroin. So I think it would really work for the people I know and the others in the community struggling right now.
Any other questions?